The following is a paid program. Advice and opinions expressed on the program are solely that of Generations Chiropractic, not necessarily WBEV or Good Karma Brands. Welcome in, everybody, to Taking Care of Business, today featuring Generations Chiropractic. And, of course, the always pleasant and always fun to talk to, Dr. Ellie. Dr. Ellie, how are you doing today?
I'm doing well. How about you?
Doing well. The weather has, it got chilly, and now it's a little bit warmer again. But fall is definitely in the air.
I think so. I don't know what has happened in the last month, 2 months. I'm like, it feels like forever since I've been in here. Sure, I know last month was a little different with the fair and all that stuff, but
You
I'm
threw
like,
a lot of things off.
where am I at right now?
Right. I did see you out at the fair. You had a booth out there. How did that go for you?
I love just being able to get out with the community and connect with people and learn more about the area I serve and how I can better serve the needs of this community. So
It was definitely great seeing you out there. I got to walk through and see a bunch of different vendors and a bunch of different people. But even though it was hot and it was warm and the area you're in is kind of an indoor tent thing and it was very warm there, you seem to be in good spirits. You seem to be having a good time.
the only thing that people are like, what would have made it so much better is if I had the clinic dog out there.
Ah, yes,
So,
Mini Pearl.
Yes, Mini Pearl has, and you'll get a picture next time because we'll be coming upon Halloween already by next time. And I'm like, that's a scary thought to think about. So I'm
Right.
like, we don't need to fast forward it that much.
Let's not.
But she has a little pig costume, and people are like, you should have put her in the pig costume and then put her out by all the animals at the fair. And
That would have been adorable, but
I know not really allowed, but
I imagine it would have also been a lot of work keeping her reined in because I'm sure she would have wanted to be all over the place.
Oh, she would have had a blast. She's like, so many people, so many kids. She would have been happy as a clam.
And I see on here one of the things we have is an update on Mini Pearl. What's going on? How's Mini Pearl doing?
Oh, Mini Pearl's alive. My patience is limited, but she's alive, so that's a plus. She has really bad allergies, and I know a lot of dogs have been working through allergies right now, so every day is a struggle to be keeping her alive right now.
That's one of those things people don't tend to think about. They think about, friends, family members, whatever, themselves that have allergies. But, if it's got a nose, I guess it's possible that it can have allergies.
Well, and it's so much more than just nose. It's the entire sinuses, entire immune system. I mean, right now, some of the things that I'm doing to help her out are we're taking her to her animal chiropractor twice a week, and we're doing and making her live in a cone. Sorry, she hates me, but otherwise she literally would itch her eyes out, and she would just get everything infected and red and itchy.
Right.
And
Then we know how that goes because allergy sufferers were dealing with red and itchy and all that as well.
And little sad, this past week, meaning yesterday and today, because it's already a week, right? Sure, that's where I'm at.
Yeah.
Sounds good, right?
That math works. Yeah.
She's been perky in the clinic, which I love to see. But last week she was like, do not come around me. People are like, oh, Mini Pearl's not here. And I'm like, no, she's here. She's just literally hiding under the front desk in the back corner so she can't be seen. Or she's hiding underneath the kiddo table in the exam room.
Right.
Those are her two favorite spots to hide right now.
I get that because oftentimes when we're not feeling well, we kind of want to retract a little bit and hide until we feel better. So that makes a lot of sense. But you touched on it. It is allergy season. And I guess I never really think about allergies and then chiropractic in the same sentence. Is there chiropractic stuff that could affect?
So one of the biggest things that, I know when the nervous system is communicating better, so your brain communicating to your body, which is really what chiropractic focuses on, not the popping and cracking in the spine, but are we getting good communication from the brain to the body? Normally, all symptoms can be helped modulated and regulated more easily. So that's why I'm taking her to her chiropractor. Yes, I know it helps her immune system. I know after an adjustment, her entire body just is into this parasympathetic state, which means this nice rest and digest, calm state, and she's able to sleep without even instantly thinking about itching. So is it, hey, this is an instant adjustment for allergies? No, but her body is so much in a go, go, go state right now that how can we get her entire nervous system calmed down so she can actually live versus whatever is going on right now?
I learned a little bit over the last year or so that a lot of what our body deals with is inflammation, and allergies kind of kicks that inflammation to overdrive. And if there's a quote-unquote level of inflammation we can handle, allergies just overflows that.
Absolutely.
And so the idea of opening up those communication lines, opening up the body's alignment so that blood flow, oxygen flow, and communication flow on all the nerve endings is in order, that can help your body deal with other inflammation so that maybe the effects of allergies aren't as bad, potentially.
Well, and there's even additional things that can be really beneficial too, whether it's for dogs or for humans. Having good omegas, because normally your skin ends up getting very icky and itchy and red and inflamed, or hers is kind of like this
Right.
weird greasiness in her hair. So omegas are the building blocks of the cells. So you have to have, again, good building blocks in order to create some of that communication too. So like, hey, what are you even looking at diet-wise to be helping reduce some of that inflammation? What are other things you might do to help reduce inflammation? And this is when we start to talk, okay, fall detox kind of thing. Well, this is a great time to utilize infrared sauna or any form of sauna too, to help get some of that inflammation to decrease and allow your body to, again, have deeper levels of cell healing to improve your overall well-being too, and health and immune.
And if somebody wanted to find one of these infrared saunas to use, I'm sure you know a location where somebody could check one out.
And it's one of the things that I do offer at my clinic, and I
Right.
just wanted to be able to provide, because like when I look at the dog who's miserable, no, I'm not throwing the dog in the sauna. She also hates summer. She hates heat. If I
Right.
could send her to Antarctica right now, she would be very happy. She'd probably be happier than she is in the clinic.
Give her a few more months, that'll be Wisconsin anyways.
I know, but it's like she's looking forward to that first deep freeze of the year, and I'm like, we don't need to get that frozen yet, but also I want you to live, and I don't want to be woken up at 5 a.m. to hearing her itch.
Oh, yeah.
So
Yeah.
anyway, yeah. Otherwise, for humans, infrared sauna is great. Great way to get some of that cell healing. Love when people come into the clinic to utilize chiropractic care, to utilize infrared sauna. Some utilize both. Some utilize just one or the other, and support them in their wellness and health journey however possible.
I will say it is refreshing to know, having talked with you, because sometimes you'll talk with professionals who mention things like chiropractic care, the infrared saunas, things like that, and they're like, oh yeah, it's definitely got health benefits, you should definitely check it out, and then they themselves don't do it. But you go to a chiropractor, you bring Minnie Pearl to a animal chiropractor, a pet chiropractor, you use the infrared sauna from time to time, so you know the benefits firsthand. So when you're talking about this stuff, it's not just from, well, this is what the books say, it's from experience.
And that's one of the reasons why I wanted to bring the infrared sauna here at this time, or when I had started it at that time. I didn't know that there was any other infrared saunas in the Dodge County area. And I think maybe there might be one or two additional ones now. Anyway, it's not like they're commonplace at all, which,
Right.
again, resource to the community. I was driving down to Madison for infrared sauna stuff, and I'm like, okay, it worked great when I worked down in Madison, and it was a 5-minute drive. But
Right.
I'm like, now this is my home ground here in Beaver Dam. This is where I live. This is where I work. This is where I want to be a part of the community. I don't want to keep driving down to Madison all the time.
Right, and I imagine anybody else who's using those services down in Madison would rather stay local for that as well. That does make a lot of sense. I do want to remind people that if you want to call into the show, if you have a particular question you want to ask of Dr. Ellie, feel free to give us a call. We're more than happy to try and answer that if you can. Or they can always reach out to you at the clinic. Let's start with the clinic number, 920-885-0641. I know generally text is the best way to get a hold of you and kind of schedule things. That's the way the world's kind of going anyways.
I feel like it's easier that a lot of people are like, okay, I can just text a response here and there, and sometimes things are a little bit disjointed. By the time I get on a phone call with someone, and if they're like, hey, I want a phone call to figure out scheduling, and if they have any immediate questions that they're like, well, can you actually work with and help this versus, nope, I just want to get scheduled. I'm like, cool, but that can easily be a 5 to 10 minute conversation already, just by the time we're looking at our schedule, they're looking at their schedule. And sometimes we can all just be more efficient of, oh, I can quick send this one message saying, oh, cool, here are 5 potential times, or generally morning or afternoon. And it's like, can get back to little other questions in the meantime.
Right, it does make things a lot easier. Well, we also allow for calling or texting. You can give us a call here if you have a question at 920-885-4446, or call or text us 920-887-9595. And I believe Jeff Hall is up in the studio ready to take those calls and answer those questions if we need it. Thank you for that, Jeff. Now, I wanted to shift things a little bit, because fall doesn't just mean allergy season. It doesn't just mean the weather's getting colder. It also means, for some people, kids are going back to school. Schedules are shifting. For moms or dads who stay at home, their day has now adjusted to where maybe they're getting up earlier, or they might have to be running kids around. There's a lot of adjustment happening in the world. which might mean it's a good idea to think about getting some adjustments going on us. Let's talk about that.
Yeah, absolutely. To me, like the fall is a good time in the clinic wherein I feel like we reset and it's like, okay, what is the routine going on, for this fall moving forward? Not that we have to like figure out and schedule everything between now and the end of the school year. That would be ridiculous too. Right. But hey, okay, when we're figuring out, are we having these fall sports and these fall practices? And oh yeah, I know like my church group is going to meet always at this time in the evening, or hey, I always have play practice at this time. One of those things that's super beneficial when you're creating your schedule is when is the time to get some good chiropractic care for an entire family. And I also celebrate this time. Like I have some families that their kids are home all day in the summer and stuff, and they get the privilege of being with them. And mom is like, I want to enjoy every moment with them because it's like Mondays and Wednesdays are their days off because kids still go to, daycare the other days of the week. And, it's like there's a mom that I hadn't seen since, the end of May that I saw yesterday. And it's like, exciting that I'm like, yes, I want to hear what's been the updates in the summer. Like, yeah, I would definitely love if you still got chiropractic care, still brought your family in for care. But also, okay, yes, it's so much easier to figure out an exact schedule and routine. Right. She's like, nope, I want to figure out when can the next time I can come in because I know these are my days at work, and honor the fact that routines change in the summer, and now is a great time to start a new routine to help your health and wellness.
Yeah, a lot of times I know, at least in our household in the summer, routines and schedules get kind of lax. Things become kind of a willy-nilly, whatever we can fit things in. However, it's tough. Last-minute decisions like, hey, we're just going to go to the zoo or we're going to go do this or whatever happens all the time. With school, it's like, all right, there's set bedtimes, there's set wake-up times, there's days the kids are at school. You're scheduling all the important appointments, be it doctor's appointments or otherwise. Nowadays, kids are in more activities, so you got to schedule around all of that. But you're pretty flexible with scheduling.
I like to think I am. I mean, we always are like, wait, can we always adapt this and that? And I just want to honor other people's time, and I want my time to be honored too. And it's just that, hey, something comes up. Okay, cool. Let me know. Like, what is this communication process going on? How can we adapt things? We have different combinations of hours that allow people to just pop in or drop in. Like, oh, it's raining, so soccer practice got canceled for today. Let's go and get an adjustment versus, oh no, I know I have the small window between dance class and getting the next kid to gymnastics, and then we have to get dinner at this time so that we can pick up this other kid from here. And I want to honor that. I'm like, no, we have some scheduled times too, just for adjustments, so that when you're in the mix of all of that, you can have variety and possibility too.
Now, I also know that with this changes in schedules and routines and working everything out, it can also be a stressful time. And stress is one of those things that can have a direct impact on how we carry ourselves, how we do things with our body. And chiropractic care can kind of help out there a little bit as well, right?
Chiropractic care is all about that brain communicating to the body again. And so, sure, we talked about in Mini Pearl, it's showing up more in allergies, some of that inflammation. But really, it's how is she adapting to stress? When we talked about that inflammation right now, hey, those pollens out there are just throwing that, straw that passed the camel's back. Something along. No, I was gonna say straw that broke the camel's back. There we go. I'm like, something is not adding up right now. So it's how can we allow there to be, more pieces of straw that can help the body live its life? Because I'm not going to take away the fact that I want you to allow your kids to have the opportunity to do this and this and this activity. But as parents, it can be a lot to drive them around and figure out all that, plus work, plus what's going on with the animals at home. And, oh, yeah, I want to cook healthy meals as opposed to going out to eat all the time and balancing and juggling all these things. How can we help your body adapt to it? I'm not going to take away saying, oh, yeah, and, now on you just don't have to eat. You don't have to worry about that stress of making meals and stuff. But how can I help you adapt to, we're going to spend time cooking. We're going to spend time taking the kids everywhere and all the things.
I've started hearing people refer to going and seeing their chiropractor in the same breath and the same level of like relaxation they get from it as saying, oh, well, mom got a spa day, mom got a massage, whatever. It's like, mom's going to the chiropractor. She's going to come back feeling better, refreshed, whatever. And I think that's really brilliant.
It's all about those adjustments are impacting that prefrontal cortex of the brain. So we'll definitely get into some of this in a little bit, and I'm going to totally nerd out about it, especially after 7 hours at this past
That's
weekend,
right. I
talking
love
more
it.
about the brain and how the brain works. But it really is that parasympathetic nervous system that we talked about that, hey, this dog is on edge, this human is on edge. How can we get them to calm down and get the areas of their spine that are lit up that are responsible for fight or flight when there's a time, if there's a bear chasing me, I want to be able to run.
Right.
But how can I overall be, no, we don't have to worry about the next thing and the next thing. How can I be present in the moment?
That doesn't make a lot of sense. Before we move on to, because I want to ask you about the seminar that came up, I want to ask you a little bit about kids back in school. I think about things like not only are they running and playing outside, which is normal, they're running and playing outside all summer, hopefully, follow it well. But now, like I think about my kids, they're sitting in class, heads looking down at a Chromebook, doing what they do. The same stuff that we say at work, you should get up and move around so you're not sitting in the same position. We're now got our kids doing that all day long at school. Any tips or tricks?
You see, I don't want to say this is a hard one, but it's kind of difficult because when you are supposed to be in a little bit more of a structured environment of here's your desk, here's your Chromebook, learn, study, that kind of thing.
Right.
As much as you can, even getting breaks, like we said, would be ideal. Something that's actually really cool and fun, wouldn't fully be adaptable to utilize in the classroom. I say that because I'm like, people are thinking, okay, if your head and neck is so far forward, which is what we're often seeing when we're spending time, looking down at a computer, well, we got to get some good motion going up and down with your chin and your neck.
Right.
That's actually not going to necessarily help with stuff and help with the angles and the facets of the joint of the neck. Some of the things that can actually be more beneficial is looking more side to side, so rotating left and right. And as you rotate there, you're actually helping some of the growth of and the angles of those facets of how the neck develops. What even is best is if you can go up and looking up at the corner of the room and bringing your whole head and neck with it and following those facet lines and rotating both directions. That ideally is actually something really good for your entire spine to help loosen that up, especially if you're stuck sitting at a desk all day.
Now, for people watching a daily live show, you get to see kind of a demonstration.
Yeah,
of that.
but I'm like, kind of hard to talk about it though too. But
Right. But I could see even in the movements you were doing, as opposed to just the up and down nod, you look like you were more elongating your neck a little bit, and I imagine that's got to be better than. And I have a sibling who does this with they put the fist on their chin and they pop their neck, and every time they do it, I cringe a little bit because I'm like, one of these days I feel like your head's gonna spin off like a soda cap. But in the grand scheme of things, there are little things you can do. They're not replacements for going in and seeing somebody and getting adjusted and getting taken care of, but they can definitely help you make it through the day without feeling like, oh, my neck hurts, my back hurts, whatever, as you reach that into the day.
another simple thing. So many kids are like, I'm going to be cool. I'm going to either have a trapper keeper. Or I'm going to have this one sling backpack thing.
Mm-hmm. The one strap over one shoulder. Yep.
I know it's cliche and kids don't want to hear it. So I'm like, well, we're going to say it anyway. Having that backpack on, having it actually at a decent height so it's like not drooping all the way down. And if it's, basically slamming them in their butt as they walk, that's not helpful either.
Right. Yeah. And I know it looks dorky to have it pulled all the way up and whatever, but if it is right and correct and best for people who are out there hiking the trails and backpacking and camping to have that up and that weight where it's supposed to be, why isn't it right for students as well?
And there's also the piece to be said for, I know some schools allow kids to have their backpacks with them all day. Go to your lockers there's a reason you have a locker too.
Right.
Don't be like, oh, it's so much easier if I just grab everything for the entire day. That's still not helpful.
Right. And although it may be better nowadays because with like a Chromebook and a couple of notebooks, it's not as heavy as all the books we had to carry around. Still, visiting your locker is not a bad idea. And it's nice to get that mobility. Walking around and being up and about is always good. Let's dive into the seminar. So this weekend, Advanced Perinatal Clinic Application. Okay.
Yeah, lots of words there.
Those are lots of words. I understood advanced and application.
Yep.
And clinical. Kind of.
Yeah, so, we're getting the gist of some of that.
Yeah.
We've got to start with breaking down some of the words to figure out where we're at.
Right.
When I first took the seminar, I took it about 3 or 4 years ago, and at that time it was called Advanced Webster Technique. We'll get into talking about what Webster is, but since then, what I love continuing to retake seminars just because people are like, if you've taken it once, what's going to change? We're constantly evolving as people. The instructors are constantly evolving. I want to constantly keep evolving my own skill set so I can best serve my people in my clinic. So even the name has changed, and we're talking about advanced perinatal clinical application. Perinatal is really talking about what is that entire time frame from a year plus before baby is born, so even all the time in mom and in belly, to easily a year after baby is born.
Okay, so that's a good span of time.
Yeah, so there's quite a range of it. And just because you're a mom and you've given birth once, you're always still a postpartum mom. It doesn't matter whether it's, hey, my baby is 3 weeks old, or, well, now my kids are 60 as I'm, 80 years old.
Right.
There's something to be said for your body changes drastically after having kids.
Right.
So especially when it comes to moms, like, you're always going to be postpartum. And sometimes it's hard for people to think about, but your body's still postpartum, even if your first child is a miscarriage, or if, it doesn't make it to full term. Like, there is something to be said for your body has still gone through all those hormonal changes too. So you got to always acknowledge that as well.
I guess I hadn't thought of it that way, but yeah, I mean, the woman's body obviously goes through a lot of work and a lot of changes, and there's a lot, you hear about, like, oh, if you had a lot of kids, it depletes, nutrients and stuff from your body, because even though you're eating for two, there's still a lot that you're giving up to build this little life. You don't necessarily get that back.
And things can change. I mean, you can always work on rebuilding and, creating stronger foundations and healing, but there's also so much to be said for, we're talking about all of these clinical applications. So it's like, how can we, see different examples that we talk about in the seminar? What might we actually see in the clinic? And it's so much more than just, hey, this is a chiropractic technique to adjust this person. This is, how am I looking at every single mom or every single child or every single person who comes into my clinic and providing them the best care that they need in that moment.
That does make a lot of sense. As we're hitting the bottom of the hour, I want to remind everybody this is a paid program, and advice and opinions expressed on the program are solely that of Generations Chiropractic, not necessarily WBEV or Good Karma Brands. If you're just now tuning in, we're sitting down with Dr. Ellie with Generations Chiropractic, and diving a little bit into a seminar that you went to recently. Now, I'm seeing some bullet points after this with a lot of words I don't know.
Okay.
And luckily, we've got you here. So I'm going to have you walk me through what we're going to be talking about.
So this is where we're going to get very nerdy. And
I love it. Get nerdy. Let's do it.
Next month is an even nerdier version of, not this exact seminar. It's not, it's more literally just all about neurology. And the instructor of this past seminar is like, I always try to just warm people's toes and dip their toes in the water, because the next seminar is always like people drinking from a fire hose, no matter how many times I've heard this, other docs speak and everything. So I'm like, cool. But it just lights me up so much that I get to talk about this, and it's like being so immersed in this. So we're really talking about the brain. Chiropractic is all about the brain. Yes, we can do cool adjustments and help people feel better, but pain is only 7 to 10% of what the body does. And I really care about what is happening with the other 90% of the body, let alone how is their brain actually functioning.
Right.
And the primary thing we like to think about is adjustments impact that prefrontal cortex of the brain. So the prefrontal cortex of the brain is located basically right behind the forehead, and that's your primary area responsible for decision making and some mood and some, well, not as much hormone, but definitely it impacts hormone regulation. But that's the decision making area of the brain that we really talk about not being fully developed until mid-20s potentially.
And ironically, the part of our head we slap when we do something stupid. So I guess there's a reason for that.
And even the right side of the brain and the left side of the brain have different responsibilities. So I'll definitely go more into that next time, because I know that's where we're going to dive even more into that.
Right.
But in short, by even looking at a person and looking at their posture, I, as a provider, am able to get so much information about what might be happening inside their body and what kind of state is their body potentially already in.
So if they're, maybe if they lean one way, or if they're, I had a nephew who was a kind of head always slightly askew kind of kid.
Yeah,
Like that's stuff that could tell you that maybe there's something that.
definitely. And even when you do some things, when you look at posture and even subtleties, if everything is more so showing up on the right side, and when I say everything, the main things I'm kind of looking at are, hey, when you look at a mirror, are you tilted a little bit right or left with your head?
Okay.
You know, shoulder height, are you equal side to side? And some people are like, well, I'm right-handed, or I always, play football or I throw something,
Right.
with the right side. Of course it's going to be higher. And I'm just kind of like, okay, cool. Thanks for the information. Not that I don't care, but I also don't care. Like,
Right.
I'm looking at something deeper than just, oh yeah, I know my muscles are really strong on that side compared to the other side. When you're even standing there, do you have one hand that naturally wants to turn out to the side a little bit more?
Right.
Or even your, as a whole, if your hands are straight down by your waist and down by your legs and whatever, does one want to sit and rest a little bit further out to the side? That's all information.
Right.
And do you have a toe that when you're standing there, one wants to be completely straight and one maybe angles a little bit? Not that it needs to be a 45-degree angle or a 90-degree angle out
Right.
to the side, but all of those are indicators of what might be happening. And then we get to add some cool other tests too. Like when we get to the clinic, we sometimes will shine a flashlight in someone's eye, not to just be rude and be like, what? But
Right.
again, like you go to an eye doctor, you do some of those tests, they're checking even deeper levels of eye stuff than that I probably even know. And
Right.
definitely more than what I know. And, some of that, but we're really looking at how does that neurology change? And like, if your pupil stays very big, you're in much more of a state of where's that bear coming from me at?
Right.
And how can I protect against that bear? And sorry, I'm getting so distracted. And I just
Yeah,
get so
no,
passionate,
no.
and you're just like, just go. And I'm like, cool. I'm gonna just keep rolling.
No, I think that's great. And I mean, and having delayed responses, because you said the bear, like obviously that's your fight or flight reflex
Yeah.
kicking in. And, that's something that you don't necessarily pair with the thought of chiropractic.
No, not at all.
But
Normally,
if things aren't communicating properly, you might be in fight or flight mode when you shouldn't be. You don't need to be.
exactly. And even the tendencies of one eye might be a little bit more sluggish or slower to respond or doesn't quite constrict as much as it should. So that's another indicator. So I normally like to think of the head tilt, the shoulder, the arm, the foot turnout, and some of the eye constriction, all of an indicator of, are you in naturally more of a sympathetic state or a parasympathetic state? So sympathetic is that go, go, go.
Right.
Parasympathetic is rest and digest.
Okay.
Typically, if you have more indicators on the right side of your body, even with more of that red head tilt, or excuse me, red right, red right,
Right.
same thing, cool, right? When you're tilting that way, you normally have a little bit of a deficit on that side of the brain.
Okay.
And people are like, oh my goodness, you're saying I have a deficit. I'm just saying there's room for improvement in your body. And it's giving me information of what might be the best way to help your body improve. Well, when people naturally are more sympathetic dominant, so more in that fight or flight state, more of that tendency to be having these right-sided neurological presentations, they're often living lives that they're just hammered with stress. So there's stress and stress and stress, day in and day out.
Right.
So if we look at, oftentimes a lot of pregnant moms are just, there's so many changes going on. They're like, I want to get the nursery ready. I want to do this. I want to do this. I'm like, what is happening? I don't know these changes.
Right.
You look at a postpartum mom and they're like, okay, I'm now trying to care for this little human being and I'm not familiar with what my own body feels like. You look at a mom who has 4 little ones at home and they're like, well, we got to run to this activity and this activity. You look at someone who's middle-aged and their parents are in nursing homes and they're like, I still want to help care for this parent, or this parent doesn't want to go into any kind of nursing home, so I'm helping take care of all of this.
Right.
There's just lots of stress. And stress really impacts the body.
Right. And those are also the sometimes people where they can be in situations where they're supposed to be able to relax. They're supposed to go into that parasympathetic?
Parasympathetic. Yep.
Parasympathetic. So they're supposed to be in that stage where, just relax, let your body calm down, and they can't.
They're literally, their brain can't turn off, so their entire body just can't turn off. So you'll often see them having, more shallow breathing, or those are the people you'll often see more that their head is coming even farther forward. So we call that anterior head translation.
Okay, anterior is forward.
Yep.
Right.
Anterior forward, and then head. Understand what
that
the head
is.
was.
Yep,
Cool. Translation is just saying that we're again sliding forward.
Right. I like it. We're on the same page. So, and these are things that like you said, they're indicators that there might be areas that need to be worked on to kind of help bring the body a little bit more into balance, to open up those communication lines, and that's something where some regular chiropractic treatment can definitely help there.
Absolutely.
That is awesome, and it's those connections that you don't always think about. You mentioned, and I'm going to go double back on something you had said, where you said, well, pain is only like 6-7% of what the body can do.
Yeah.
Oftentimes for people, pain is the indicator we give ourselves for something's wrong, something needs to be fixed, something's out of ordinary. But there could be a lot of other indicators, and this is what you're talking about, that aren't painful, but can be precursors that by the time we get to pain, we may have already overlooked so many different road signs on that travel.
Something that so many people overlook is, what is your balance and coordination? Oh, I'm just an uncoordinated person. I just trip or whatever. I just fall, stumble. Balance and coordination does so much. Every single joint has these receptors that are supposed to be telling your body where you are in space.
Right.
And if you aren't having those receptors that are firing, that are stopping you from falling and tripping, that's not a good sign either.
I mean, that's part of like the whole development of the human body is like we have such advanced brains, which allows us to do the upright ambulatory walking that we do that a lot of other creatures can't.
And you start to even forget that balance and coordination is something that can neurologically or through chiropractic be impacted.
Again, keeping those channels open. And when you think of like the communication level that has to happen, when you think about all the little nerve endings and sensors in our feet and our body that tell us that we're a little out of balance, things like your inner ear and stuff can all connect into that. All of that's got to communicate up. And if anything doesn't get that message across, you might think you're falling when you're not. You might feel vertigo when you're not. There could be a bunch of different things.
Okay, we're going to jump back to, because again, my love is taking care of pregnant mamas, babies, and
let's do
kiddos. Pregnant mamas, their center of gravity is changing so much. Their balance is like, how do I, again, figure out my own body? Well, pregnant mamas are the second highest fall risk category of any people out there, yet we rarely screen for that. We rarely test for what is, a pregnant mama doing to protect her balance and help allow her to be more coordinated.
Right. And I mean, I'm guessing the second group is the elderly.
No. So I was going to say, so
Okay.
they're number two, but number one, not just elderly, it's people with Parkinson's even. So
Okay.
they fall behind Parkinson's, and there's enough elderly that would still had better quality balance than pregnant moms.
Wow.
And that's a scary thought when you think about it that way.
And when you think about a pregnant mom falling, I mean, it's not just her that you're then worried about, but you're worried about, baby.
Yeah, so for pregnant moms to be the second highest fall risk category, and you're like, well, elderly, that would make sense for number one.
Right.
No, a specific subset of the elderly even.
Right. Wow. And so what do we do? What do we do for pregnant mom out there to help with that?
Get them some chiropractic care. And also very specific when it comes to pregnant moms. There's so much nuance when you take care of a pregnant mom. Don't just go to anyone who isn't trained in that area just because it's like, yeah, we see everyone from birth to elderly and pregnant and all these things. Someone who's really trained and knows what they're doing, because pregnancy is a special time in someone's life.
I mean, you wouldn't go see the person who fixes your furnace to fix your car just because they can fix things. Mm-hmm. So why would you go to any chiropractor necessarily if you're looking for a specific pregnancy or baby or young people, that kind of thing? Like, you obviously don't do the chiropractic for Minnie Pearl. You take her to a
Animal chiropractor.
Yeah, so
exactly.
that makes a lot of sense. I want to move on a little bit more into stuff that you had talked about with your at your seminar that you were at. We talked a little bit about the right side brain deficit. Mm-hmm. I see a note here about the left side brain deficit, and I see the list is not as long, but I see some things on here like depression prone.
Yeah. So this is even kind of interesting when we look at the left side. Probably a good indicator is about 60 plus. I'd say probably about 60 to 70% of the world is more of that right side. We're constantly hammered by stress. Mm-hmm. So those who have more of that left head tilt, left arm out, those left-sided findings that I previously talked about, normally what you'll find if you ask them about their history of their life, that they've had some big trauma going on. So whether that's a concussion, whether that's a car accident, whether, hey, I played soccer for millions of years. I never was diagnosed with a concussion, but, I probably took multiple hits as I hit the ground and everything like that.
Yeah, it was the 90s. We all took head hits, right?
Exactly, but you don't think anything of it, too, of, even people are like, oh, well, like 10 or 15 years ago I had a concussion. Well, whatever, but if you don't actually heal from some of those things, your body might still be showing up that you're not firing that side of your brain correctly. So when you even look at some of the differences of left-sided versus right-sided, those left-sided people who also have more of those left findings, yes, they're in more of that parasympathetic state, so you start to think, rest and digest, and, more chilling out, but sometimes it can be a little bit more chilling out than ideal. So, like, they might be more of those people prone to depression versus if you have someone who's, with the right side deficits, more prone to anxiety. So if we look at these things of, hey, sometimes, especially postpartum moms, if someone is showing up with left-sided findings, that's where we want to keep a closer eye on them postpartum, because you hear about postpartum depression, or, hey, those might be people who get hit by seasonal changes and seasonal affective disorders, and their brain just isn't communicating as well in those areas and might be prone to some of those mental health things that are more depressive versus others that are more anxiety ridden.
And again, that's something where, there are some chiropractic steps that you can take to kind of help open up those channels, hopefully reestablish that communication and that activity to help.
And especially creating community. One of the biggest things with chiropractic is I want people to feel like being in the clinic is a safe community, a fun community, and for them to create that sense of belonging, because even that does so much to help resilience in any type of people, whether we're depressive, whether we're anxiety, whether any of that, we need community in order to thrive.
Well, and I've seen, because we've had on the show before, we've had pictures of kind of what it looks like inside the clinic and the way you've set things up. And it's one of those things where I think if I was somebody who was high stress and had a lot of anxiety, I would walk in and think, okay, this is a chill, relaxed, comfortable place. It doesn't feel like a white-walled, institutionalized medical facility. It feels more comfortable. Mm-hmm. If I'm somebody who is in a depressive state, I walk in there and nothing in there is going to make me feel worse. It's going to make me feel like it's still a comfort place. I'm not going to feel like I need to, suddenly shift into that fight or flight. And it's also not going to knock me down any. Mm-hmm. And so it's got that nice middle ground, obviously set up intentionally to be comfortable. Plus, you deal with a lot of children. And the typical medical facility can be scary.
Mm-hmm. And I don't want the kids to be thinking that at all. I want moms to be like, okay, yes, when I'm on the table, the kids can still be playing and, everything is cool and safe and good for them. And then it's like, hey, then they swap spots in time for the kids to get adjusted on the fun kiddo tables. Want to make it a good environment for everyone.
Now, you talked about this, and I'm going to read it again. The Advanced Perinatal Clinical Application used to be called the Webster Technique.
No, so there's the Webster Technique.
Okay.
The seminar used to be called the Advanced Webster.
The Advanced Webster. Okay.
Yep.
So what is the Webster Technique? I'm assuming it's not like hitting them with a dictionary.
No.
Okay.
No. Larry Webster, he's the one named after a chiropractor, so, not the dictionary thing.
Not the dictionary guy. Not Merriam-Webster. Got it.
Yes.
Okay.
Larry Webster.
Yeah, right.
So this is a technique it's a technique and an analysis. So even some of the things we've already talked about, that's even part of some of the analysis process too, because adjusting someone can be, I'm going to say honestly, the easier part than compared to some of the analysis. Because if you get your analysis wrong, it doesn't matter how good of a technique you have. If you don't have a good assessment process, what's going to happen from there?
Right. I mean, it's kind of like if you went to the doctor because you're like, hey, I think I broke my arm, and they look at your leg and only work on your leg, it's not going to help your arm.
Exactly.
Makes sense. Okay.
So we call it both an analysis and an adjusting technique. And it primarily was focused on Larry Webster working on a whole bunch of pregnant mamas.
Okay.
And even pregnant mamas with less than ideal baby positioning. So we might talk a breech baby or a transverse baby. Mm-hmm. When you get further along, especially, by 36, 37 weeks, you want your baby head down, ready to be nestled into the uterus into the pelvis, they're all good to go. Doesn't matter whether baby is going to be a vaginal birth, or if for some reason you're like, you need to have a C-section, or belly birth is how I would rather call a C-section. You want the baby in still that ideal position because it helps with their own brain development and their development in all of these things. So when he came up with some of this technique and analysis, it originally was called the Webster breech turning technique, because he found out you release some of these different things in the pelvis and you adjust certain things, and whoop, baby's now head down. That's what we want.
Okay. I mean, that's definitely good.
But there's, the fine line of, okay, what is in our scope of practice? It's not in our scope of practice to be palpating baby or feeling baby, and even what position is baby in, or, hey, I'm actually even adjusting baby inside of mom. No, that's all obstetric stuff. That's not chiropractic. But we are able to help what is going on with baby inside utero. So now we call it more the official Webster in utero constraint technique. So that's basically saying in uterus, there's some kind of constriction going on with baby and uterus that it's not in an ideal position.
Right.
So how can we just help release some of that tension? Our intention is not to turn baby. It's rather, what I like to say, create a luxury pelvis. So if you're nice and tight and twisted, that's not going to feel ideal for mom or baby. But if, let's say, you're wringing out a towel, well, that's not comfortable. But how can we just help release that towel so we're just, hey, we're straight and happier?
It makes me think of the number of times, I know this with my wife, when she was pregnant with one of our kids specifically, and I've known it from other people where they're like, oh, I feel like their head is right in my hip. Or like, oh, I feel like they're off to one side or whatever, and they're pressing and that can cause some issues and discomfort, and also can lead to, I've seen where pregnant women get into the most funky body positions that are comfortable, and the rest of us look at them and go, it's like watching a house cat. How are you comfortable stretched like that? But that's the only way that they can be in, that they feel like everything kind of feels okay.
And there's things you got to also sometimes honor in different exercises that, if they're feeling so comfortable in a very unique position, they probably intuitively know why they want to be in that position. Right. So what are maybe even some additional official exercises, or just different stretches, different ways that we can suggest to get a mom to get into different positions to help release some of that tension and release some of that pressure and help the overall process for everyone?
I want to touch on a little bit, because you mentioned making like a luxury pelvis.
Yeah.
Which obviously that helps with aligning everything up. Like we said, the birth canal thing and all that other fun stuff that if you don't know what we're talking about, you'll find out eventually probably. You mentioned development, and I think about, we're compressing a little being in there, and as it's stretching and growing and pushing back, it's still being compressed quite a bit. Lots of things are being squeezed on: body joints, nerves, blood vessels, the brain. By creating this ideal environment, are you essentially kind of helping with like letting some of that development happen, letting some of that stuff that needs to happen before it's even birthed?
So in chiropractic, the number one thing that when we adjust is we're adjusting these subluxations, or, the fancy word for these misalignments. And then you can get very philosophical, because chiropractic is, we call a science, philosophy, and art. So we need to have some of these conversations about, when does this first subluxation or this first misalignment actually occur? Oftentimes you'll see posts and stuff that say, okay, first subluxation, 99% of babies are born, and that birth process in itself is that first misalignment. Well, let's go back and talk philosophically of, if baby is even twisted and unhappy and fighting for space inside of the womb, can a subluxation occur there?
Right. Now, can there, like, and I don't know if there's an answer to this, but if there's, a mom who's like, oh, this baby seems to be kicking more, pushing more, and trying, could that be an indicator that maybe there needs to be some adjustments on mom to make room, or just active baby?
I can't say I've noticed any correlations between more of an active kicking baby kind of thing, and if there needs to be more of an additional need for some things to be checked. especially when mom is feeling, oh, I have a lot of that round ligament pain, or my belly just feels so heavy, or there's sharpness there, or everything just feels so tight, or yeah, baby is jamming me in the ribs.
Right.
Those tend to be more concrete and applicable symptoms or presentations that it's like definitely in need of an adjustment for you.
There is a line in here, and I love that you included this. You said, how we care for our moms says a lot about us as a society. And I think that's brilliant, because obviously your practice focuses a lot on the little ones, the pregnant mamas, and then that time after their, the postpartum time frame. And, you include the families, the generations, that's in there. But that's where a lot of your focus is, because that's an area that maybe not a lot of people focus on.
When I started the practice here a little over 2 years ago, there was no one trained and certified in pediatric and prenatal chiropractic. It's something that this area, and I really do believe all of humanity deserves, is someone who is skilled in that area to care for what I think are some of the most vulnerable people in the world. Yes, some people are like, okay, well, the elderly are very vulnerable. Absolutely. And that's where a lot of people focus with chiropractic already.
Right.
And what is the vulnerability of this brand new tiny infant? What is the vulnerability of mom growing this human being inside of her?
Now, some people might throw out there and say, well, sure, there's a lot of changes and stuff that go on with a woman's body when she's pregnant. There's a lot of changes that go on in a young child's body as they're growing and developing, especially in those early few months as they're elongating and stretching and their body position is changing. But that's such a small portion of their entire span of existence. So is it really that big of a deal? Is there really that much going on?
Number one thing that we talked about, chiropractic is about how do we impact that prefrontal cortex of the brain.
Right.
What is happening in the brain? The most brain development is happening in utero through the first year or 2 years of development when baby's outside. So within that 3-year time span, why would you not want to be getting chiropractic care if that's when chiropractic care impacts the prefrontal cortex of the brain and impacts the brain, and that's when you have the most brain development going on.
And then we've talked about how that prefrontal cortex continues to grow and develop up until our mid-20s, or more. And so continuing on with that, not a bad idea.
Chiropractic care is great for people of all ages. Even once I've now made all my decisions. Okay, I'm over 25, it's cool. A lot of that can get to be how do we clean up what wasn't addressed really early on.
Right. That does make a lot of sense. Unfortunately, we're running out of time here. So is there any final words you want to say on this before we let you get back to Mini Pearl for the day?
Basically, I just love the opportunity to be able to serve pregnant mamas, babies, kiddos, everyone in the community, because every time you see a mom, whether she's pregnant or postpartum or, again, multiple years down the road, stepping into motherhood creates a new version of yourself. And I want to just keep seeing the world continue to evolve to be our best version of ourselves every single day.
That's awesome. Remind everybody how they can find you, where they can find you, what social medias you're on, websites, and the number they should call if they want, or text is even better, if they want to book an appointment.
So Generations Chiropractic. So website is generationschiropracticwi.com. Social media has been rough lately, so we're going to ignore that.
Okay.
Otherwise, calling or texting the clinic at 920-885-0641 would probably be best.
Awesome. Well, Dr. Ellie, it's always a pleasure talking with you. I love geeking out with you over all this stuff. It's a lot of fun, and it's obvious we can see the passion you have for it.
Wonderful.
Awesome. Well, this has been a paid program. Advice and opinions expressed on the program are solely that of Generations Chiropractic, not necessarily WBEV or Good Karma Brands.